Good evening, Nigerians. It's another Tuesday, and Tuesdays are for Talking Here with Dr. Laz. You are tuned to your channel of choice, Africa Independent Television, AIT. My name is Dr. Laz Eze. The previous month has been that of the good, the bad, the ugly. That's talking about October. Young people in Nigeria took to the street to push for end to police brutality using the hashtag #EndSARS. Of course, the campaign was peaceful and very organized, as many Nigerians could attest. But along the line, there were skirmishes, reports of use of force by law enforcement agents, reports of counter-protest, and so many things happened and culminated into 2020, that's 20th October 2020, when peaceful protesters at the Lekki Toll Gate, were allegedly shot at by men in military uniforms. It took a different turn entirely. Massive lootings, destructions in different parts of the country. Health facilities were not spared. You have health facilities attacked, hospitals, medical stores, NAFDAC office, health department, even offices with things looted. From Abia to Rivers, from Edo to Kaduna, from Cross River to Adamawa, from Lagos to Ondo. All these states, we have reports of attacks and looting in the health sector. It's a very saddening event. So that brings us to our topic of today. We'll be talking with persons who witnessed this happen in one of the facilities, and I also have an expert in-house who is going to weigh in. She has a background as a consultant physician and also a retired law enforcement officer. But before I introduce my guest and we speak further on this, we are going to take a break. Please don't forget to follow us on our social media handles displayed on your screen at Talk Health Niger, whether on Twitter, Facebook, or on Instagram, and subscribe to Talk Health Niger TV on YouTube. Also, you may also follow me at Don Laz for you on Twitter. Please, let's take a break and we'll be right back. Welcome back to Talking Here with Dr. Laz, your favorite health program on television. Before the break, I told you that health facilities were attacked across the country. The Abia State Dental Center in Aba, as well as the Abia South Health Authority, was attacked. In Adamawa State, we have Bishop Makanto's hospital that was also attacked, and also the State's Primary Healthcare Development Agency completely looted, and the medical stores also ransacked. In Cross River State, the biggest health facilities were at the Federal Neuropsychiatry Hospital. The patients were pushed out of their beds and even the beds stolen. It was that bad. The University of Calabar Teaching Hospital, as well as the Infectious Disease Hospital. In Edo State, it wasn't spared. Health facility was also attacked. In Lagos State, Lagoon Hospital, as well as another hospital in Ajah area, a private hospital. In Rivers State, Oyigbo area, Divine Grace Hospital also was looted and burnt. In Kogi State, Central Medical Stores, vaccines, so many things. So I'll be speaking shortly with one of the survivors of the attack at the Federal Neuropsychiatry Hospital in Calabar, Dr. Agwu Nwogo. He will be joining us via phone. I also talked to Dr. Emmanuel, Uwah, the chief resident at the same hospital, And in studio with me to talk about this is Dr. Grace Okudo. She's a retired Assistant Inspector General of Police, but she's also a medical doctor, a consultant dermatologist, and a member of the National Advocates for Health. They will be weighing in to speak about this within the next couple of minutes. So, Dr. Agwu, are you here with us?
Yes, Patrick.
Okay, thank you very much for joining us on this program. You were present during the, I'm seeing Dr. Uwah, welcome to the program. You were present during the attack in your hospital. Please kindly explain to Nigerians what you saw.
Okay, good evening, my chief, and good evening, everyone. Good evening, Nigerians. My name is Dr. Agwu, Nwogo, a resident doctor in the Federal Neuropsychiatry Hospital, Calabar. What happened that day was very traumatized event. It's not something that you wish your enemy to witness, because I can't imagine. I've never heard that hospital is being attacked by the citizens, no matter how violent anything could be. That I've never heard that hospital could be attacked. So that Saturday morning, I was on call on Friday evening, so Saturday morning. So around that 8:30 in the morning, I was about to hand over to my colleague who's supposed to take over who's supposed to be on call, on Saturday call. So I just said, okay, let me just go and drop some of my stuff in my car, like my laptop, my clothes and all that, because there's a coffee. There was a coffee on Friday evening by 6 p.m.
Yes.
6 p.m. the coffee was declared to the next day. So I was like, okay, since there's coffee, so it's better for me to be on my scrub if I'm going, so that at least the law enforcement agency, when they see me, they know that I'm actually an essential duty. So let me go and drop my stuff inside the vehicle, and then I come back and do my proper handover.
Okay.
So, of course, drop my stuff. I dropped my stuff. I saw some guys passing on the main road. You know, the gate was shut, but I can see some movement passing and passing. I said, I thought there's coffee. Why is this other people see passing? For? Does it mean that some people are exempted from the coffee or not? I just thought it in my mind.
Okay.
So I now went back and do my handover to my colleague. And when I'm about leaving, one of my senior colleagues now walking.
Yes.
I said, Doc, are you the one on call? I said, no, I'm just handed over. It's okay. Are you about going? I said, yes, sir. He said, no, don't go. Just stay behind at least next 30 minutes or 1 hour, because these movements I'm seeing there, you may not be safe.
Okay, Dr. Agwu, sorry for cutting you short because of our time. So at what point did the hoodlums that attacked the hospital move in, and how did you get out of the situation?
It was 10 minutes later. 10 minutes later, when I now went upstairs. So suddenly, generator off. Because I went into the doctor's lounge. I was in the doctor's lounge. Suddenly, the generator off. I didn't need people know what happened. I saw hearing noises. People were just rushing in. And I saw people trying to put up AC, people trying to bubble, people trying to do a lot of things. I was like, what is going on? I pick up my phone and call my chief resident and say, Chief,
okay,
something is going on here. We have been attacked. It's okay. I should just hold on. I should stay where I am. And they are sending some help to us. Suddenly, I saw noise from downstairs, because I'm in upstairs. Saw noise from downstairs. They already put the burglary, the potato downstairs. And I saw people coming upstairs. Jesus, I said, I can't stay here. If I stay here, it will be worse, because if they're meeting me here, I don't know what may happen. I decided to start walking down.
Okay.
So I now rushed to my car, because my mind was, let me go and change so that I can be like them.
Yes.
By the time I got to my car, they have vandalized the car, they have took my clothes, my laptop, and some of my belongings. So at that point, I was confused. I can't change anymore, because I'm on scrub. They can easily identify me and know who I am.
Yes, the scrub is the wear that doctors use when they are in the hospital.
So at that point, I was like, okay, start making calls. So I was calling my chief and saying, Chief, we have not seen any help. See, these people are more than 10,000 people doing things, just patients.
More than 10,000, you said?
More than 10,000. As in the car was so, but they were everywhere.
So how did you get out of the hospital?
I had to get the fence. They saw me making calls.
Wow.
You know, then now, some of them that still, and saw me making calls, they were like, they were running after me. And when I saw them coming, one of them wanted to bring out the gun. The other one says, use machete, that's what I heard, use machete. As the guy now stand the machete, wanted to cut me. I had to give my hand. Immediately I give the guy my hand, he now cut through my hand. Then at that point, I don't know how I was able to lift myself to calm that thing. I couldn't explain what happened. Because I had to throw the phone. As I threw the phone at them, so I had to scale the fence and jump to the other side. So they now went back to the car and they now vandalized the car and every other thing, like the hospital bed.
Yes, we are going to get details of that from the chief resident. Thank you so much. So sorry about it's a very horrible experience you had, and one can only imagine how traumatized you are. So have you been getting any form of support, psychosocial support from the hospital authorities or from anyone since this happened?
Yeah, my chiefs have been calling, everybody has been so concerned, have been talking to me, and I'm getting better, I'm taking my drugs, and I'm getting better.
Okay, thank you very much, Dr. Agwu Nwogo, a resident at the Federal Neuropsychiatry Hospital in Calabar, who survived the mob attack and looting of the hospital. Thank you for joining us on this program.
Thank you, sir.
All right, you heard all that. Dr. Okudo was shrugging when that was ongoing. We'll take a breather, and we are going to get more insights on the extent of damage in that hospital from the chief resident. Welcome back to Talking Here with Dr. Laz. Dr. Emmanuel Uwah, the chief resident at the Federal Neuropsychiatry Hospital in Calabar. Hope you are still with us, joining us via Zoom. Hello, Dr. Uwah.
Good day, Dr. Laz. It's nice being here.
Good evening to you. Thank you for joining us. You heard your colleague, what he explained. Can you give us a picture of the extent of damage, how many health workers were affected in the hospital, and what you think Nigeria needs to know?
Okay, to begin with, the incident that Dr. Nwogo just described happened on the 24th of October 2020, and it actually affected everybody that was on duty that day, ranging from the doctors to the nurses, the pharmacists, even the health assistants who were on duty that day. It's quite sad that some of them incurred injury, while others had to suffer personal losses, which were scattered away or was destroyed. Now, beside the personal losses that these individuals incurred, the persons also went ahead to vandalize hospital properties. And this included the seminar rooms, the doctors' call rooms, the call rooms of virtually all the staffs who were on duty, the lab scientists, the pharmacists, and they even went ahead to enter the ward and disrupt activities in the ward. It's quite sad that the patients also were made to witness this horrific event.
That's really sad, as you said. So have you taken stock to know, like from health workers' perspective, how many that were affected? I'm aware that the hospital is a 200-bedded hospital, so one can imagine the number of patients that may have been affected.
Yes, we are currently taking stock of that. And certainly the hospital would have a definite figure of those affected, ranging from the healthcare workers and the patients that were affected during the crisis.
Thank you. Last question for you. From this current situation, I know that discussion must have been ongoing in your hospital. Your medical director was on a program on AIT some days ago, where he also provided some insights about his communication with the Minister of Health. So apparently it's like the hospital is on ground zero and shut down. When is the earliest period you think things might be fixed? Do you have any idea that the hospital can pick back up?
Well, we wouldn't want to fix a date as to when the hospital would go back to running optimally, but the hospital management is poised to ensure that we render clinical activities. We recommend offering services to our patients who come to access care in the hospital. We also recommend attending to patients who are still in the hospital. So to the best of our ability, we would try to provide services and see how we can cushion the effects of the crisis.
That sounds good. Have all the patients returned, some that left during the attack?
We've been able to reach out to as much as possible, the ones we can, and we've also been able to reach out to the relatives. And we are sure that most of them we've been in communication with are safe, and some we've been able to we get them back to reconnect with their relatives.
Okay, thank you, Dr. Uwah. I'm sure being a neuropsychiatry hospital that you may also have plans for psychosocial support for members of the hospital community who must have been terribly traumatized by this ugly development, and perhaps reach out to your colleagues at the IDH and UCTH that were possibly affected to ensure that the health workers also have their own mental health intact. Thanks for joining us on this program and talking to Nigerians.
Thank you.
All right, we'll take another break and I'll come to the studio and have a conclusive aspect of the program, having Dr. Grace Okudo, AIG retired, to wade in on this. Please stay with us. We'll be right back. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Dr. Okudo, that's just one out of 17 health facilities that have been able to track across 10 states. Even General Hospital Ibokoda in Ondo State was affected, and so many others. Hearing about all this, how does that make you feel, from being a health specialist, a health advocate, and also a former law enforcement officer that served at a very high or senior level?
It's really sad, I must say. That really brings me to one important aspect of healthcare delivery. We must try as much as possible to sensitize the community around us. Okay. And you must also try to have them buy into the healthcare delivery system or healthcare facility in that area that serve them, because it will make them feel that they feel the kind of ownership of the facility. I'm sure if that had been put in place, I don't think it would have been as bad as this. It's really sad, I must say. Very distressing. So
by the health facility, I'm just wondering how that could have prevented the attack at Bishop McIntosh's hospital in Yola or the Federal Neuropsychiatry Hospital in Calabar, given that by the design of tertiary care, the community has minimal role to play as compared to primary health care that is owned by the community.
No, it's also part of it. There must be a buy-in. The people should be made to understand the kind of service that is being rendered to them.
Okay.
And they must buy into it and know that it's their own and protect it. Because we also heard about stories about people who stood up to protect some monuments, even people's residents, because those people had a kind of relationship with the community. So it's all about not just bringing something because you think you need it. Let's drop it here. There must be a
community participation.
Yes. It is lacking in most of our healthcare system.
So the point you've made, yes, there's need, and every healthcare facility should begin that engagement so that any facility, any community where they are located will have the sense of ownership. Very I think the Adamawa State Governor gave an ultimatum for persons to return what may have been stolen from the medical store and other parts of the state. And say they'll go house to house search, and any house where they see any of the looted items will be demolished and all that. Some persons have criticized that perhaps is not the best. So from your law enforcement background, what's your opinion on that?
It's not a very good decision to demolish. It's illegal to demolish the property because, you have to take them to court.
Okay.
And it's only when you take them to court that it will be decided whether they are guilty or not. They are only alleged to have done looted.
Okay, that's very straightforward. So what about some persons are wondering the mental state of people that carried out
that is also sad. From what has happened in the past few weeks, we now know there are two sets of youth: the disciplined ones and the not so disciplined that go on looting. No matter how much looting is looting.
Looting is looting. Yes, our time is very fast spent, but I would like to get your insight on what you think going forward, looking at it holistically, how would the states recover from where vaccines are looted, the impending infectious disease outbreak that may happen if children are not immunized, where hospital equipment are stolen, and all that. What will you have to tell your recommendations to the state governors, the Federal Ministry of Health, and law enforcement agents, and Nigerian youths going forward?
Yes, we have also learned a lesson or two in this thing, what has happened in the past few weeks. That people should learn also to insure their businesses, whether government or private.
So that's insurance insure the health facilities?
Yes.
We also insure the central medical store?
Yes, they must be insured because there are prices to those things. So they must be insured because insurance insure against likely misadventures such as fire, looting, stealing, robbery and all that. So most of these businesses are not insured. And besides, this idea about educating and sensitizing the people is very, very important. I know it's going to be very difficult to recover some of those things.
Yes.
It's a society, the community that will still suffer.
Okay, that's a good point to end it there. Thank you very much,
welcome.
Dr. Grace Okudo, consultant physician, president of Nigeria Association of Dermatologists. I missed that earlier, as well as the retired Assistant Inspector General of Police. Thanks for making our time to join us in this program. That's the much we can take today. It's a very sad one. What I would like to put to this is we own the health facilities, and the health facilities serve us. Whether it's public or private, is unconscionable at a time like this for any facility at all to be destroyed, let alone hospitals and medical equipment that is used to cater for the rest of us. Nigerian health sector is already on its knees. Let's not make it lie down with its chest. Thanks for being part of the program today. My name is Dr. Laz Eze. We'll see you same station, same time next week, but don't forget to follow us on our social media platforms right there on your screen, and also follow us on YouTube and keep watching the program. We apologize to persons with disability that we are unable to bring sign language interpretation today, but in subsequent programs, we'll make sure that we get it included. Bye for now.